Yeah. Right.
Because I'm thinking,
No, the contract.
I'm saying it's 10 to 6.
Right.
Oh, yeah, I didn't even notice the LLC.
I was thinking
Okay. Well, I didn't know that's what you call it.
I
Definitely, yeah.
Oh.
You're right. I'm oriented. Don't get me wrong.
You have to do it with 2 coats of the spray before it just seals. But I think it's all those ribs and all those ribbons. So I'm thinking,
Oh, okay.
Well, it won't be right.
right, and then
It's been morning. Or at night.
Jane was afraid it would rain.
Yeah, I think a bunch of people did.
No.
That's what I.
Oh, I know.
You're too late. You're way too early.
Nice.
Neither are good. huh?
Now you still there?
Not your time for being here.
Till it's done, John. All right.
Yeah.
I'm just telling you, the dial told me. The whole area.
Yeah, that's right. We were kind of at it.
Well, with my phones, the way they work, I straight remember.
Two colors, two roll. Yeah. Over 100.
But
I did.
thought it was gonna be early.
You're right on that. You're right.
Actually.
She gets me in the brain.
Why are you doing
Oh, yeah. That's another 5 yards.
Oh, sure. Do your driveway problem. On the road.
I did just the opposite the other day. Had it off, and then when I came in, I turned it off.
I'm going home. Along with people.
I just did it. So see what I did? I came in. Because I was doing it in here.
Yeah. Yeah, we all do it.
A lot of sand, not clay.
You're fine. I think I collected me some new batteries.
Yeah, we gotta look at the clock here.
Yeah, it's 10.
Oh, my God. Okay. Okay, at this time, we're gonna call the meeting to order. Gentlemen, stand for the pledge, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for that. Before we get started here, I got a statement to make. Last regular board meeting got a little out of control. I'm going to apologize to the board, and especially April, for the personal attacks on her. It was uncalled for, and that shouldn't have happened. With that being said, we'll move on. Roll call, please. Yeah, approval of the agenda.
I have an addition,
Okay.
or did you?
I got it.
You have
Go
it?
ahead with yours.
Oh, I'm sorry, go on with the agenda. I mean the minutes. I need to change the minutes.
We got a CDBG mortgage release as add-on. And we have a
New business or old?
New.
That's new. And under old business, we got, the clerk wants to, give us an update on the recount August ballots. That's an add-on. That's the only two things I got for this. There was one item on there for an appointment to McCall, but that's been removed already.
Okay.
So with that, anyone else got anything?
Make a motion, we approve. Support. As amended.
All in favor, say yes.
Yes.
Nays? Motion carried. The approval of the minutes of September 5th.
We need to add to the minutes, because I had requested. They were discussing that there isn't clarity on what the board expects of the mechanic, and I had asked her to add to the minute. That the mechanic has been requested to complete inputting the remaining county fleet vehicles into enterprise maintenance record as he was trained and started the process in July or August. I guess I can just say. Okay, I kind of wrote mine. See if that helps you in my writing. Then, is that better? That way there's clarity.
Oh, any problem with adding that on there? The consensus is just add that from this first miss.
Thank you.
With that addition, it's any other additions or corrections?
With that addition, I'll make the motion, we accept the minutes from September 5th.
Have a motion? A second? All in favor, say yes?
Yeah.
Yes, nays, motion carried. Claims and accounts carried.
Okay, claims and accounts, our claims came in at $67,938.97. EFTs came in at $462,362.71. Desk checks came in at $74,368.25. For a total of $604,669.93. And I make a motion to approve the claims.
I'll second that.
What is that statement at the last line there under cousins are not in grievance, would like that put in?
Which one are you
Under the
looking at?
finance, the sheriff, about the inmate medical expenses being higher. And then the last line says cousins are not in grievance, would like that put in. Who's cousins? I mean, what is?
So there's actually two things you probably could make motions with during the claims and finance meeting. One was an addition of $1,000, well, Chad had requested $1,000 for the inmate medical expense to be increased. And then he brought up the bereavement policy for someone's cousin had passed away, but it wasn't listed in the bereavement for the 3-day pay. And it's not in the contract, so it's up to, it would be up to the board if you were going to allow that.
What is it in the contract?
It's supposed to be bereavement, not grievance.
Yeah, it's bereavement, not grievance.
It's right. I was gonna bring it up during sheriff.
It's a
but
type.
It's supposed to be bereavement.
Okay, yeah, I would, that we,
Oh, that makes-
I would move that we would correct that.
What are you gonna make it a motion to?
Well, would you like, do we need to do that?
Well, I'm gonna make the motion.
Well, let him do your
Yeah.
claims
First.
roll call first,
Okay,
the payment.
yeah, okay, be a roll call, please.
Olson,
Yes.
Edwards,
Yes.
Jordan,
Yes.
Hardy,
Yes.
Stelter.
Yes.
Let's put that off to the sheriff talks. We'll do it, you know. Anything else? We got public comment on agenda items only. Is there any public comment on agenda items only? Hearing none, we're moving along to new business, the 2024 tax rate request on the L 4029 approval. Is that in the packet?
And I hope so. You have to
Well, I
sign
think
it.
I have so much paper with you. You're probably right.
Here's the copy because I signed.
Oh, got it. Oh, that's a signed
Yeah,
copy?
yeah, you and Cheryl both have to sign it.
Okay. What's the increase
No.
this year?
All of our new villages plus the COLA that was on last year.
What?
It's all of the new villages. So none of those were rolled back, and then our COA that was still on from last year that was rolled back. If you do not approve them, we do not levy them.
Questions on the equalization director reference to 2024 L 40? No one has any questions or concerns directed towards her. Someone can make a motion to approve.
I make the motion to approve the 2024 tax rate request.
I'll second it.
We have a motion and a second. Any questions or discussion? A roll call vote on that, please.
Edwards,
Yes.
Garden,
Yes.
Hardee's,
Yes.
Peltier,
Yes.
Bolster.
Yes. Motion carried. Opioid funding request by Dr. Jason Betty.
And here's.
Oh, right front row. Okay.
Front row. So I can stand?
Stand or sit, whatever you want to do.
I'm comfortable sitting, I guess. Seems informal. Although I didn't realize when you made the comment about the madness that took place recently, I didn't know I was gonna have to fight for this. I need some time to train. So the reason I'm here, and I really appreciate y'all giving me a few minutes, and to give you a little background on myself, I myself am in recovery. I use that to fuel me through medical school. I come from two people that suffer from substance use disorder myself, both my parents. In fact, my whole family. So just to give you some idea of why I'm so passionate about what I do, it's because I'm one of them. When I started medicine, I realized there was a humongous gap in treatment. In fact, the practitioners really didn't understand addiction at all. So patients, their end result was generally incarceration or death, which is really unacceptable in the medical field anyway. So I didn't like that. So I decided I was going to do addiction medicine. So I trained through Michigan State, St. Joseph Mercy. I did a family medicine residency with a special interest in child abuse forensics, as well as substance use disorder. So I had volunteered for the Child Advocacy Center for a couple of years, offering my services through DeVos, is where I had trained. But as we started Freedom Recovery Center, which is the company that I own, we opened clinics across the state, which I worked on at every single one of them. So I traveled all month long because there was, again, shortages in all these areas, the UP, counties around where we were, and then Alpena, I was realizing there's no money for anybody. So what had happened was for about 5 or 6 years, we see, well, and currently we see many patients for either free or a deeply discounted rate. Now that obviously comes out of our pockets because we have no way to fund that. So at one point we realized we were seeing about 30 or 40 people in Alpena County. So we turned to those commissioners first and came up with a scholarship program. So we asked them for a bit of money, and what we did with that money was turn it into a scholarship. We call it the Alpena County Commissioners Scholarship Fund. And currently we have 12 people, 12 families on that scholarship, and still room for more. What that does is that because of the laws, the way we have, if you take insurance, the way you have to charge for insurance is you're forced to charge the patient the same that you would charge an insurance company. There are ways around that with federal sliding fee guidelines and so forth. But even then, it only brings it down to about $125. A lot of these families aren't making $700 a month. They just can't afford. That's a lot of money to pay for healthcare. So we had, like I said, we had taken them for free or for whatever they could pay for the longest time. But two things happen when we do that. One, of course, our funds get lower and lower and lower and lower, but the patient also feels like it's a charity because there's no skin in the game. With the scholarship, we have them pay a little bit, which is $25. They can usually come up with that. They feel like they're putting some skin in the game. They feel like they're being active in their own healthcare. So far, like I said, we've got 12 families currently taken care of in Alpena County. What we noticed, though, we started paying attention to how many patients we are getting calls from each week from Hillman, Atlanta, this county. We're getting at least 7 to 10 calls a week, which tells us that there aren't enough providers here to take care of the people that need the help. We do have the room, so we take them. But again, the problem is quite a few of them are underinsured or uninsured. So we're taking them for free because nobody else will take them. So we're looking for a way to start a scholarship fund for the people from this county as well. With that scholarship, what we do is we help them find, not only they get their medical care, but we hook them up with psychiatric care, psychological. Every one of them sees a counselor monthly. Drug screening is also covered under the scholarship because that can get a little bit expensive, unfortunately. We hook them up with housing. We help them find housing, transportation, anything that we can find to help these folks better their lives. The goal is never just to treat the disease itself. It's to help them transition back into life, which is difficult. I mean, again, a lot of the professionals out there, both in the criminal justice system and in the medical system, still don't quite understand how addiction works. Everybody's working really hard trying to figure that out. But in the meantime, the patients are the ones that are stuck in the middle. So we are there to try to help softer landing for them, help transition them over to something that's a little bit easier for them, get them back into life again so they're productive members of your community and our community. And we do share. I mean, we work very closely with Thunder Bay. I helped them get their program started. Since I was the first doing it, I helped them get theirs going. We work very closely with Catholic Youth Services, as well as the Sunrise Center in Alpena. Madeline, the director over there, was regrettably can't be here today. She was going to come for moral support, but she woke up with the flu, unfortunately, just my luck. so I ventured out on my own. So that's why I'm here today, and I really do appreciate all of you taking some time to listen to me. And if you have any questions, I'm all ears.
Okay, what was the request?
So we asked for, I believe, 16,500. We figured that would help us with about 15 families. We're currently seeing 8 from this community. I think all in, 4 of them are free. The other 4 are uniquely discounted because they have a little bit better income. But again, we're talking about families of 3, 4 people, transportation issues. I mean, it's healthcare shouldn't be a burden, in my opinion.
And that would be utilizing the opioid funds.
So
Yeah.
it was a 6-month total for 16,800.
Yeah.
Was his request, which is 10 patients per month, an average cost of $280 per patient.
We refigured that a little bit, and I think I can stretch that to 12 months.
Yeah, I think it's a good program with faith and like that, especially for.
Correct.
Want to make the motion on that?
Well,
Go ahead.
I was just going to say, how do the people apply to the scholarship?
So they don't have to. When they call us, if they're in trouble, we take them and then we make that determination within the first month. Once we see their financials and so forth, we make the determination. Right now, it's just it's a Jason Beatty scholarship fund. It's basically what it is. So, which is fine, but obviously I have to be able to pay my employees as well. So that's where we're in trouble. So we're seeing quite a few people for nothing. We'd like to change that a little bit. Like I said, it helps them to feel like they've got a little skin in the game. We can cover some of it, and they can cover a little bit.
You mentioned how many families from our county.
Yep.
How many are turned away?
So we don't turn anybody away. We either try to contact Thunder Bay to see why there's a gap. That person might have been there and just didn't qualify for services or what have you. So that's one area that we end up with trouble. So can you repeat the question for me?
I just wondered, do you have more people applying to you than you're able to help and you turn them away?
So currently, no, we're not turning anybody away. And we're getting, like I said, on average, I would say probably around 5 to 7 calls per week. Not all of them convert because they'll find somewhere else to go, or they'll figure something else out, or their insurance finally kicks in, or whatever, they figure out something different. So we don't have to turn anybody away currently. Of course, there will come a day where we would have to if we don't have the funds, but at the moment, we've been doing okay where we're at. Watch the funds disappear slowly, but they're not draining out quickly. It's not a full insanguination. So yeah, I guess to answer your question, we don't turn anyone away. We work really hard at trying to find them somewhere else if for some reason we can't take them. But up to now, we really haven't had a reason not to take a patient.
Our current fund balance for the opioid settlement funds is at 144,814.71. We just got more payments that came in, so we do have funding in there to use, and this does follow under the remediation appendix that we have to apply for.
Yeah, I make the motion to accept the proposal.
We have a motion to support. Any more discussion?
Is that's coming out of the opioid funds? Okay.
I will also, at the end of the year, I will give you an count, so you know how many people you've helped.
Do you work with, are you from a hospital or clinic? in the
No,
area?
we own our own clinic, it's Freedom Recovery Center. We have a clinic here and one in UP currently. So we work with both. We're based in Alpena.
Thank you.
Any more questions, discussion?
Just
No,
what
roll,
the,
good.
just what the motion is to accept the,
So the motion is to provide through the opioid funding, the requested $16,800 from the Freedom Recovery Center for Montmorency residents to access recovery. You can clean that up.
opioid funds, opioid.
Right,
funds.
yeah.
Freedom Recovery Center's proposal to provide the 16,800 from the opioid funds.
Yes, to the Freedom Recovery Center. For Montmorency residents to access. Does that
Lori's no longer on this.
Freedom Recovery Center's proposal to provide 16,800 from the opioid funds. And you said you wanted a roll call.
Roll call vote, please.
Gerardin,
Yes.
Hardee's,
Yes,
Pelletier,
Yes.
Ulcer,
Yes.
Edwards.
Yes. You all set?
Thank you so much.
You're welcome.
You'll hear from me soon. Appreciate your time.
MOA landfill audit letter approval.
So the MOA landfill finished up their audit. Every year they send us over documents that we have to sign as a board, since they're one of our component units. So I just need a motion to approve. Basically, they're saying that the letter, in this letter, it matches what we have in our audit, what their financial statements would say, and the chairman has to sign that letter. Their auditors also have to sign the letter. They've done that part already, and then I send it all back to Connie.
You want a copy of that, Maria? All right.
So the. That's fine for me. I'll read the letter out for you if you want. So it says, "Dear Mrs. Oyer, as chairman of the Montmorency County Board of Commissioners, I am submitting this letter in support of the Montmorency Oscoda Alpena Solid Waste Management Authority's use of the financial test for closure and post-closure costs as specified in the Code of Federal Regulations 40 CFR, Part 258, Section 258.74. The landfill is owned and operated by the Montmorency Oscoda Alpena Solid Waste Management Authority. Montmorency County is a constituent municipality of the authority, as are Oscoda and Alpena counties. My submission of this letter has been duly approved by a vote of the Montmorency County Board of Commissioners at its meeting." It just gives that.
Okay, I guess if you got any questions or concerns, we do this every year, by the way. This is nothing new. So I guess I'd entertain motions to have you sign
The motion that you signed the
financial certification form for MOA.
I'll second that.
Did you get that?
There's a motion by Gerardin, second by Pelletier to sign the
The certification letter for the
MOA landfill.
MOA. Yeah, it should be a roll call vote too, I believe.
Hardee's,
Yes.
Pelletier,
Yes.
Bolzer,
Yes.
Edwards,
Yes.
Girardi.
Yes.
Sign the letter. Next item on there is a CDBG mortgage release. That's an add-on. Then what's that?
Okay, so we have the mortgage date August 28, 2013, by Thomas Prince and Jewel Prince, in Atlanta. And there are released, they just need approval to release that mortgage from the CDBG.
They paid it off.
They paid it off.
I would move that we sign the mortgage release.
I'll support.
Here we go, a motion and a second, any discussion? Hearing none, all in favor, say yes.
Yes.
Nays, motion carries. Just the one signature? Next item on there is the ARPA closeout, it's treasure.
We missed the recount update. Yeah.
No, they put it on old business.
That's under old business.
Yes, the ARPA committee met September 5th, and a motion was made to use the remaining funds of $57,254.95 to help cover the cost of the cloud conversion. So that would take care of the rest of the ARPA funds, and, you know, they will be fully committed by the end of this year, fully spent by the end of 2025. So we'll need a motion from the board to make that transfer. Is that all we need to do, right? We don't need to write a check.
And then do we do the close out to transfer and close out of the
Yes.
funds?
Yes, we can.
I'll make the motion that we transfer those funds and close it out.
I'll support.
Motion to transfer
$57,254.95 to cover the cloud conversion.
And then
Or
how do you,
to help cover the cloud
and then what do we say and to close out the ARPA
and
fund?
close out the ARPA.
We got a second, we got a motion, second.
Mhm.
In order of discussion, call for a vote, all in favor, say yes.
Yeah.
Yes, yes, motion carries. Huh?
It's money.
Should you do a roll?
Okay, do
Yeah.
a roll call on that.
Pelletier,
Yes.
Bolzer,
Yes.
Edwards,
Yes.
Girardi.
Yes.
Hardee's.
Thank you.
Motion carried. Prosecutor software upgrade, and I believe she was at her last meeting and telling us that she got to upgrade her equipment, and the reason for it, the state mandates new equipment.
It's not equipment, it's software.
Or software,
So
I mean,
it's, they go through PAM, which is, their association that they have, and PAM has decided they're gonna roll out this, Carpel, the new function for them. And they're paying all the upgrade costs for it, for all the prosecutors in Michigan. And then we will have our annual licensing fee to pay after 3 years. Currently, we're paying about $3,000 a year for that. And it, after 3 years, this is gonna probably go up to $4,700 with the new program. But when talking to Pam and Vicky, that we might have less users that we actually have to utilize, so that 4,700 might be a little high, so that could change. But they are covering all this, and I just need a motion to approve that contract for her to move forward with all that.
I'd make a motion.
You have a motion?
I'll second
We have a second to the motion. Any discussion?
To approve the, is it
The software upgrade
So,
to Carpal for the prosecutor's office. Do you need the dollar amount in that?
yeah, we're gonna do a roll call on that.
No, there's no, because the total amount,
Okay.
no, not till the end.
Oh, gotcha.
Need a roll call on that?
No, I was talking about, she asked if we need a dollar amount, and they're
Oh.
covering the cost, so there's no initial cost, it's just signing the contract to move forward with that.
But we are spending money.
Yeah, we have.
Definitely.
money.
Yeah, you can make a roll call, I was just saying, I didn't have a dollar amount.
Roll call, please.
Olson,
Yes.
Edwards,
Yes.
Gerardin,
Yes.
Hardee's,
Yes.
Peltier.
Yes.
Motion carried. Next item is an add-on, it's per request of the Cheryl, to recount August ballots. Cheryl,
Yeah, good morning. This past Thursday, the recount took place, so we had a recount for the position of county treasurer that was requested for the Briley Township election day, as well as the early vote ballots. So that took place. It did take all day, so it took a little bit longer than I thought it was going to. So our costs on that for the per diems and the mileage came out to $924.42. The findings of out of the recount was, they started out with the election day ballots for Briley Township. The original count that was recorded, for that election for Eggett was 145. The recount number after the recount, that was 144. For Rogers, the original count was 274. After the recount, it was 275. They then proceeded on with the early vote ballots, and the original count for Eggett was 35, and after the recount, it remained at 35. For Rogers, the early voting count was 70. It started out at originally, and it ended at 70, so there were no changes. It was requested that the recount team sort the early voting ballots by precinct and township to review for any sort of ballot rotation inconsistencies, which was a big topic here in the last month or so. Where somebody indicated they thought that their ballot, their and their husband's names had been, their ballots looked different in the name rotations. Those were reviewed, and there were no inconsistencies found.
well, so they rotate or didn't they not rotate?
They, not within the precinct, okay, so they rotate by precinct.
Okay,
So you start out Elbert Township alphabetical, the next township Briley or whatever, Avery switches to the other person's name for his rotation.
so you say that in Briley,
Within the Briley Township, the rotation names remain the same on every single ballot. So in that case, I believe Miss Eggett would have been on the first name listed for treasurer. Her name remained on all of Briley Townships first. There was no rotation within the township, which is what they were claiming, which would be against the Michigan ballot standards.
okay, all right.
So there were no inconsistencies found. And that's pretty much it.
So with the absentee votes, are the absentee votes the early vote?
I'm sorry, say that again?
The absent, so where are the absentees? Where do they fit in to your early voting? I mean, what were the absentees?
They don't.
Like people that voted absentee, I mean.
Absentees are processed on election day by the townships. If anybody on early voting, if you were an absentee voter, you could opt to go into the early voting polling location and actually tabulate your ballot in person.
Right.
Okay, and then I guess I'm not, does that answer?
No, I'm just asking, you had for the people that voted in-house, the
Election day,
election day, and then the early votes would,
Correct.
I'm assuming are the people that went to Briley to do the early. So I'm just asking, where were the absentee?
In your election day count. Election day includes your absentee voters. and
Unless
your
they came in early.
in-person voters,
Unless they came in early.
unless they chose to go on to the early voting location and feed their ballot into the tabulator separately.
So that absentee vote is actually part of the early
Yes.
voting.
Or, well, no.
Could be either.
Part of
It could
election.
be
Oh, could be either.
Could be either.
Yeah, there's if you go in with your absentee ballot on early voting day, there's a button, a tab on the poll book, the electronic poll book that checks you in that says convert that absentee ballot to an in-person.
Any more questions of the?
And the early voting township was Briley.
They're the host, correct. So all precincts can vote during those 9 days at the Briley Township Hall.
It's still voted within their own precinct.
Correct. So if you're from Montmorency Township, you'll get a Montmorency Township ballot. If you're from Briley Township, you get a Briley Township.
So the $924, where does that come from?
Well, it comes out of the election budget. There was $500 collected.
Oh, that's right, okay.
Yeah,
So there was cost us $424 out of the election.
Yep.
Okay.
be over and over, yeah.
Thank you. The next item on there, the control report.
So we were talking about it in finance already, but the inmate medical expense needed to add additional funds for that because it's over budget by $260 right now. And in the meeting we requested $1,000. I looked and we're approximately getting about $150 per month for prescription reimbursements. So if I can work on adding $1,000 to that line to cover it.
We talked about, I mentioned 1,500 because I think it's gonna be closer to that than 1,000, so.
Yeah, it's been about 150 unless there's a big thing going, but it's about,
So I
like
guess
this
my-
month, August was 120, the month before was 140.
So this is.
So I'll work on the budget to see if I can get anything moved around in there to add
Well,
that money to that.
is that okay with the board, put 1,500 instead of 1,000?
Yeah, where's that coming from?
If I can find any ways to change anything in the budget, I can add it into it. If there's anything that's not being spent right now, we just move it. That way you don't have to add anything to the bottom line. Otherwise, you could make a motion to just add $1,500 to the bottom line.
There's, I guess within the corrections budget, there really is not anywhere to move money, I guess. But if we're talking about trying to stay within that budget line, there's literally nothing but.
No, I'd have to go like in revenues and see if there's.
I'm
anything-
sorry?
I'd have to look at like revenues and see if there's any reimbursements we've had that I could increase our revenues and then increase that line. So
But you're not talking about pulling from?
No.
Okay. And I don't know, I mean, Judge, the one thing I was actually thinking about when the gentleman was speaking here, I don't know if we're allowed to use opiate funds for inmate medical. I don't know if that's an allowable expense, but if it's something to look into, might not be a bad idea.
I'll check.
Is that what it is for money?
It's for inmate prescriptions. But I'll look and see if that's,
Yeah,
fits
that
the
might be an
appendix.
appropriate use of it.
I'll check. Okay. Myrma, the 2025 renewal, I submitted the questionnaire to them, so we'll get figures, what our costs will be for 2025 soon. Camp Grayling, there was a resolution sent to us from Crawford County that they're opposing the use of state lands by Camp Grayling by permit. They're asking us to pass a resolution stating the same. I put it in your packet, so if you could review it, and then if you want to add it to the next agenda, let me know.
Is this like the one we passed last year?
Well,
Because it
A
was the
little
same thing we
different.
used.
Little
yeah,
different,
they
it's a
said
little
it'd be by
different.
permit, they would request to use
Yeah.
that land for a period of time, apparently, over carte blanche use. I think that's probably the difference in the resolution, would be my guess.
I mean, can we go ahead and agree to put that on?
Yeah.
Yeah.
you put it on.
Add it to the agenda,
Do it.
okay, I'll add it to the next agenda.
Who was the man that spoke to us that time regarding that?
Thank you.
I have to look at the minutes, I remember, I don't remember either. We had a fire drill here and we came up with some, Fire Chief Corey Cullen was here and we came up with some things that we had questions for our locksmith and EPS security. So I've reached out to both of them, got answers on it. I'm gonna be working on it with Corey to get it set up the way we need to get it set up. Also, we're gonna probably do a after hours drill, again, just to test a couple different things while the alarms are going off to see how things work. And then we'll have updated maps and guidelines that'll go out to all the departments once everything's completed. Also, the camera system is working here and we have no issues with people, like our court systems, they can view the cameras. And there's been a bit of a, the sheriff's department's having issues getting it to work for the viewing the courtrooms. And I reached out to EPS and EPS doesn't handle our camera system ever since we switched to maximum security. Like maximum security set that up for us and they would help us with getting things from it if we needed it to. But when EPS came on, that wasn't one of the things. They weren't going to be monitoring our cameras. So they looked at it, but they'd have to probably cost us money if they were going to replace anything. So I'm going to work with IT to see if there's any way we can just get the remote set up and fix somewhere internally. And maybe one of the techs from EPS can help us try to figure that out, but I'm working on that right now too. Got an email from Chris Watts from the union PLC. He called me and then emailed that they wanted to just postpone the demand to bargain on the jail administrator position and the duties associated with it. They would like to postpone any further meetings at this time and then they could possibly reconvene talks after the next fiscal year budget has been established. So just notifying you guys that is on hold. There was a local court management meeting on Friday and they approved the budget for fiscal 25 over there. And there's 2023 surplus funds that will be coming from that back to Montmorency County in the amount of $35,329. Of that amount, 14,213 is from the juvenile, 7,426 is from circuit, and 13,690 is from the friend of court. So they'll cut us a check for that amount to come back to us. And then the fiscal 25 contribution was set at 21%, which is down from the 22% the year before. And so we'll be having to contribute the following amounts. It's $78,443.19 for circuit court, $14,022.27 for juvenile, and $20,083.35 for friends of court. The building department truck is being delivered today. The new lease truck is going to be here. So that'll be ready to go. And then we'll be posting in the paper on the website sealed bids for the old truck. The Blue Book value right now coming up for that is $86.30. So we'll see what we can get, but I will get that posting out. So you'll have probably bids to open up at the next board meeting for that. I sent out the templates for the fiscal 25 budget. The deadline to turn everything in was Wednesday, yesterday. I have a few, but I'm still waiting on a few more. Once I get everybody's budgets back, then I'll get them all put together and then we'll have a budget committee meet up to go over everything and see where we're at. Fiber phones and the servers. So the splicing for the fibers completed for both the sheriff's department and the county building. And it's not connected yet. We sent out, I got dates from the courts that would work with them to be able to kind of like shut down. Not going to disturb anything for them. So I sent them to our IT company and then he's going to arrange that with all the other vendors and tell me which date is going to work. And then they'll come in here and they'll do everything at the same time. So that should be happening hopefully by the end of this month. If not, it was the 1st of October that we had another date set for that. Once I know the date, I'll let all the departments know. Just a couple quick updates of just we talked about that Klaus summons for the plat amendment. Our attorney answered on that for us. As of yesterday, there was still no maintenance data entered into the fleet program, just so you know. And then I also emailed you a copy. Eaton County has requested support to contact state legislators about reviewing the PA 202, which is about MERS funding requirements. They're expecting you to be 100% funded by a certain date. So they're just pushing our elected officials to kind of reach out and kind of squash that from happening if you can. So I sent all the information to you guys in your email, so you have it. And then that's it for me.
Thank you. Treasurer's report.
So the BSNA conversions that are starting to happen, Loud and Vienna is complete on our end in our tax system, so that's why I've given you the third quarter revenue report, so. New claim forms, the new claim form for retroactive remaining proceeds prior to December 2022 is posted on the state treasury website and on the Montmorency County website now. They are due in by March 31 of 2025. So anyone who we foreclosed on prior to December of 2022 has an opportunity to collect their surplus proceeds. Projecting state revenue sharing, the Montmorency should see a revenue sharing increase this year of about $17,726 based on the 2023 taxable values. It could increase slightly as it will be based on 2024's. And then I included the chart there for you. Now we had an issue when we spoke about it in finance, I believe, maybe even 2 weeks ago. Had an issue with a check that was sent out to Thomson Reuters or Routers, however they say that. That was taken probably in the mail, we don't know yet, and whitewashed and made out to someone else for an additional $10,000 or $12,000.
Yeah, $12,000.
Yeah, we had implemented a thing called positive pay, thankfully, a couple of years ago, and this catches that. So they flagged that, they send it to us and they say, is this right? So we're able to look at that and say, okay, it's check number, 1004. We look at our check number 1004. Yeah, it was written to Thomson Reuters and it was written for $257, not $12,257. So we tell the bank, do not pay that. So that eliminates that risk of having, a check cashed for the wrong amount or to the wrong person. It was also whitewashed so that it had some individual's name on it, not the business name. So we took care of that the first time and turned around the other day and got another one, probably the same check. They did it again. They put it to a different person and they made it for $5,247.
And they changed the check number.
So yeah, they're quite sophisticated. And if you were to look at it, you'd never know. But we pretty much daily have positive pay communications from the bank and we check those out. And like I said, we take it, we look at our check number. Kathy immediately noticed the check number changed because it was way higher than anything we're using. So she's like, no, we don't have checks that high yet. So like I said, it's been a good, we do pay for it and we pay fees and service fees and things like that to the bank of about $200 a month. So, but for $2,400 a year for, like I said, we've had this now for 2 or maybe 3 years. And we just save $17, by catching that one at this point. And I did reach out to Thomson Reuters and they are checking on their end to see if there's anything, it could be in the mail, it could be happening in the mail. We don't know.
Did they get paid?
They did. They ended up getting, yes, they got their check that we rewrote the first time.
We reissued a check.
We reissued, yeah. And then
But they
like I said,
reused the old one.
they reused the original one they had and whitewashed it again. And then, so like I said, it's very interesting.
One of the things when we sat at one of the cyber fraud meetings with Nicolay Bank, that was one of the things they said that they're seeing happening more often. That's why they're pushing for the positive pay and ACH withdrawals, because checks are going in the mail. Mail takes a little bit of time. Somebody intercepts that check anywhere, or say they go to somebody's mailbox and they see a handful of checks and they pull them out. They grab them out and then they whitewash them off and resubmit them into their names and put them in the bank and try to cash on it.
And this
the common
latest
thing
one,
that's happening.
Yeah, we noticed too that it was submitted, you know how you can take a picture of your check for your bank now? That's how this last one was submitted. It was just a picture. So it's a good thing that we have and a good thing that we got it. And like I said, it has saved a ton of money already.
So what do they do? They try to track that person down?
Yeah, they will try to track them. Yeah.
So why is there, do we need to change a policy then so that we're using more of the automatic fund transfer or?
No, I don't think so.
No,
No, we try to set up ACH with our vendors as often as possible. If they haven't our office will send out a email or a in the mail to the vendor asking if they'd like to set it up as an ACH, and then they can give us their information and we can do it that way. We check on that regularly, but some choose to have the paper check, and that's what we continue to do with those ones if they want it, but they have the option every time to see what they'd like to do.
And we've done more and more ACHs, and there are risks with that too, but it's minimal compared to what they're doing now with paper checks.
And another security feature of the bank, when a new ACH is put into the bank for withdrawal, the bank will call my office to say, okay, this is a new account number that you're sending money to. How did you receive this information? Did you talk directly to the vendor? Did you, like, they make sure that somebody didn't just give you random numbers. So there's a lot of security checks with Nicolay, which it's nice.
That's all I have.
Sure, so.
Morning.
Morning.
So inmate medical, we're all set on that, is that correct?
Yep.
Okay. The second item was the other one that was discussed in finance, and that was reference what Commissioner Hardee's was reading on the bottom. I guess what I would request is allow the department head to authorize bereavement. What we have an individual that they had a family member that doesn't fall under the guidelines of bereavement family, and I would like to allow our team member to use bereavement time to attend the funeral. It's specifically, it's a cousin, and cousins are not listed within it. Aunts and uncles are, cousins are not. So I was requesting that be allowed for bereavement purpose.
Yeah, I thought about that, and I think that should have been brought up in negotiations, and if that was really an issue with them, and it wasn't, that I'm aware of, unless you can tell me it was.
And I think April, when we were talking to finance, I feel like it was brought up, and whether it just kind of fizzled out or we didn't discuss it further, I don't know. But that is what it is. And
the original agreement union contract was very vague. It was very just immediate family. And when we updated this contract, we added in aunts and uncles and other things. And that was a big conversation. That's the language we ended up settling on. It was not a long conversation, but it did change from the previous contract to be more inclusive. But obviously we didn't include every single, which when we go down, which I guess if you try to do that, you'd be writing
I guess my take on that, if you want to reopen negotiation, that would be nice, because we got some things too we'd like to talk about. So I guess if they're that adamant, they can open up the negotiations for that, couple of different.
Well, I can appreciate where you're coming from with it, Mr. Chairman, but I'm asking about taking care of one of our.
Well, that's up.
Mr. Chairman, that's fine. If the board feels that this isn't an important thing and you don't like, I'm not talking about just for my office. I'm talking about for Cheryl's office, for controller's office, for anybody that you allow the department head to have that discussion with their employee, with their person, to say, it might be cursory or outside the identified bereavement, but we all have loved ones that might not fall within those guidelines. This is a family member, and I'm just requesting that our person be allowed to use bereavement time for it, not to open a negotiation. I'm asking the county to allow it. If you don't want to, that's up to this board.
Yes, ma'am.
35-year hospice nurse. I'm a 35-year hospice nurse. And family is who you make it to be. It might not even be a blood relative. And that person could really use those days. So there's exceptions to every guideline or law that we write. And it's set in there, immediate family, aunts, uncles. To leave it to the department head, maybe to bring it for approval. But if a department head brings a special circumstance to approval for bereavement, they know that employee better than anyone. And that person may really need it. So my recommendation is, if there's something that's out of what's in the black and white contract, that department head brings it here for approval, just like they are. This person had someone very special and needs these 3 days. to go do whatever they need to do. And I think you grant that. I think there should be a motion and it should be
Thank you.
granted in this situation.
All right.
It's special.
In our union negotiations, we updated the policy to match the county policy, and the conversation we had, just so we're out, is that everybody nowadays, the family dynamic is different. So your aunt and uncle might be who raised you. So those cousins could be considered siblings. I know, but I'm saying those cousins might be considered siblings. So we talked about that in the negotiations, that there could be exceptions where if you were raised by such and such, and that's why we put that you have the discretion in here to make that call. Because it wasn't, we did talk about all that, because family dynamics nowadays are so different. Grandparents are raising kids, and you know,
Friends
aunts and
are
uncles are
raising
raising kids,
kids.
friends are raising kids, and so we did discuss that. But that was why we changed it from what it was, because before it was very black and white. It was like if your parents passed away, or your brother and sister, or your spouse's parents, and it was very vague, and we added to add more in there. But that was the reasoning why, is because of the family dynamics changing. Just so you know how
And we
negotiations.
left it open for the board to make that decision, or the department head.
It was up, the board can have discretion. The actual wording is that the board could have discretion to give them, grant them unpaid time off. And then we listed, and I'll read you what it says. All employees are eligible for 3 days of paid bereavement leave for the death of an immediate family member. An employee may use accrued but unused vacation, sick leave, paid time off if additional time is needed. Additional unpaid time off may be granted at the discretion of the county on a case-by-case basis. For purposes of this policy, immediate family member includes the following and applies both to the family of the employee and the employee's spouse/significant other. Child, including foster child and stepchild, spouse/significant other, sister, brother, parents, including the foster parents and step-parents, grandparents, grandchildren, and aunts and uncles. You must provide notice of your need for bereavement leave as far in advance as possible. The county may require documentation supporting your need for bereavement leave.
So our policy states what we can offer unpaid leave.
That's what the union contract in the policy states.
Well, that's always been the case. They can use it.
Well, that's what I was asking, yeah.
They've always had that option, so. What's the board's wishes?
Well, I would hesitate to open it up too broad so that anybody can take bereavement anytime they want, but it sounds like, you know, so then do we do it on a case-by-case basis brought to the board, or do we leave it to the department head to make that call, or leave it as is? Sounds like our options.
Well, our policy states that we can grant them the bereavement time.
Right, so we could do that in this case.
Right.
I guess I'd like a little more information. Is cousin close? Did they grow up together? Are they 1,000 miles apart? I mean, that make a difference to me. I've got a cousin I've never seen. He died.
I wouldn't be coming to you if this was not important.
Well, it's important.
Yes, they were close.
They were close, and it wasn't like they never see each other.
Correct.
Okay.
Correct.
What's the board's wishes?
Well, I don't think we would ever deny anybody time off.
Well, the point is, you want to pay for it. That's the
Right.
question. It's not really the sheriff can give him all the time off he wants.
So the deviation from the policy is they want us to have it paid versus our policy.
That's
saying
correct.
it's unpaid.
That's
Yeah.
the issue.
Well, I mean,
Correct.
if you give them time off, they have the ability to use their comp, their vacation, or personal time. What he's asking for is just allow 3 paid days that doesn't eat into
The other funds.
their other leave banks. That's what he's asking.
Yeah, that's
It's for 3 paid days that doesn't take away from their leave, is what. Your options are to just allow it to be used as unused, as on county unpaid, or to allow it to be county paid.
Well, that's up to the department heads. They can give time off for anyone as much as they want. You know, that's.
Well, the union contract states like the board, the county can decide on a case-by-case basis if you're whether gonna give them the extra time off. But you,
The paid extra time off.
no, it said for just
Well, we don't,
unused.
we don't have any, I mean.
In the case of a bereavement.
We still don't have any control of that. The sheriff can make that decision. He can give them the 3 days vacation now and let them go for another week or whatever they need. That's not our call. That's the sheriff's call. How they get compensated is a completely different issue. Am I right, Sheriff, on that?
Yeah, I agree. with
I
that.
think that's
That's
the
the
question. Are we, if he gives them time off, are we going to take away and they use their medical or their vacation time?
Are there banks and the other options like with leave and, I mean, do they not have enough in the other funds? Because I know we've talked about other times that they have so much vacation they can't use. So, I mean, is it a situation where there's no other alternative to be?
That would be a question of the sheriff. I don't know how much time he's got.
I don't know, I guess that's. I guess the conversation's really gone. What you spoke, man, I agree with what she said. I'll be quite frank. I don't know, I'm just assuming every other department head here probably doesn't have a majority of individuals trying to frivolously take bereavement time. It just doesn't happen. Not at least that I've experienced. When somebody's asked to take bereavement time, it's for the loss of a loved one. This individual is a cousin. Aunts and uncles are included. I'm asking that consideration be made because this is the cousin that they are significantly close with. You know, the old saying is your first best friend is your cousin. That's this kind of situation. It's tragic. He was young. There's children. It's a sad day, and I'm requesting that the 3-day bereavement be allowed for this situation. That's what I'm asking for.
You're not asking the board to allow the 3 days. You're asking the board to approve 3 days pay.
Correct. Yes, bereavement time. Yes, that's, I guess when I say that, that's exactly what I mean. Bereavement time, paid 3 days, period.
I think
That's what I'm asking.
The bigger long-term question is what's the cost to the county? What's the likely cost to the county over time? You know, because as far as I'm concerned, I just soon let them just do that at their discretion. But the bigger question beyond that is are we exposing the county to a great cost over time? I'm not seeing it, but sure.
As a department head, I would appreciate the ability to bring to the board a special circumstance like he's asking for. And, you know, make it be on a case by case basis. We don't have to change policies or anything else. If we have that, you know, if you already have that ability to approve it on a case by case basis, then yeah, I don't, you know, like I said, as a department head, I appreciate that. You know, because we do have, yeah, I'm just thinking that, you know, we do have situations like April said where we don't, you know, family is not necessarily blood anymore. And, you know, if somebody loses somebody that's that close and they need that time off and they can't afford to take it unpaid, you know, we're gonna deny them that.
Well, if they got time, we don't know if they got time built up or they don't have time built
Yeah,
up
but if
either.
we bring it to you, like I said, as a department, I would bring it to you on a case by case basis. And
I guess if, you know, if we do that and it gets out of hand, that can always be reversed.
Well, I mean, you start one, what are you gonna do? Deny the next one? No, you're
Yeah, I
not.
don't know.
No,
That's
you're
the
not. You're just
question.
continue with it because Bobby got it. Now Billy wants it. You know how that works.
Well, I know how it works. I'm just wondering how we're talking about how widespread that ends up getting.
I don't know.
I don't either. I don't feature it being that way,
Okay.
but
So, normally if somebody was to leave for 3 days in our offices and they're gonna get paid, it's not going to affect the budget because we budgeted so many hours every week already for that person. I know in the sheriff's department might be a special circumstance because the question would be, do they have to bring somebody in overtime to cover for it? That could be the only way it would be an additional cost to the county. So if he's coming to you and saying they need it, like, I don't see it being a budget issue because we do have budget amounts for overtime to cover such situations. And we do have that person budgeted for a certain amount of hours already in their pay period. So it's not, do you know what I'm saying? It's something that's been budgeted for in that instance.
And just to speak to the controller's point, there is not overtime that's gonna be utilized to accommodate this situation. We're able to keep that within the schedule. So there's not an overtime exposure.
Okay. What's the board's wishes?
On a case-by-case basis, I would make a motion that we allow this case to be paid the bereavement pay for those 3 days.
And we have a motion of support.
Do we,
Any more discussion?
do we need a
For,
letter from the sheriff not setting a precedent?
Well, that's,
No, because you already have in your policy that you would talk about this case by case, and it matches our county policy.
case by case basis. It's gonna be, so we do have a motion second. It's not gonna be case by case. So if the clerk brings up someone we want to give extra time to pay for by us, case by case. You know. So I don't see as how things work here.
I don't see an epidemic coming to Montmorency County and that many people dying off.
Well, no.
Don't curse us, knock on wood. Don't put us there.
If that happens, that's the least of our worries.
Any more discussion? Hearing gonna call for a vote, do a roll call on that.
Edwards,
Yes.
Gerardin,
Yes.
Hardee's,
yes,
Peltier,
Yes.
Meltzer.
Yes.
I have no problems case by case, but I can tell you right now, once you start this, the board, this board and the next board is gonna have a very rough time not giving someone that. That's the only thing I'm saying on it. So, especially got a new board next year, so they might have a totally different take to all this stuff. Anything else, Sheriff?
Yeah, thank you for that, by the way. Our entire team went through a 16-hour de-escalation training last week. We're very fortunate Alpena hosted it, so we didn't have to worry about lodging or anything like that, but real good training put on by a nationally accredited de-escalation center. So that was 16 hours that every employee, all the road ended up going through. We have a DTAM behavioral threat assessment management training coming up here next week that some of us are attending. So there's a lot of training that goes on this time of year. And so we have a lot of officers going to different trainings right now, which is a good thing. It's a great thing. It gets frustrating because it's very condensed. So scheduling can be difficult. I don't know if you heard, but there was a situation in Hillman yesterday that we ended up doing, or not yesterday, I apologize, Tuesday. And it just kind of goes to show, nothing happens in Montmorency County unless it's a Tuesday at 11 o'clock in the morning and there's two people trying to break in. Yes.
I didn't hear what the incident was.
There was, it ended up being two juveniles that were attempting to break into homes.
Into a home.
Well, garage, stole cars from a couple different counties, ended up being here. The undersheriff ended up being there because we had one officer off that day, had to pull the school resource officer from Hillman. They ended up going, I ended up going. Fortunately, it worked out reasonably quickly. Within about 20 minutes or so, both juveniles were apprehended. And now they moved through the system, but Tuesday morning at 11 a.m. we had 4 officers tied up on attempted B&Es and stolen vehicles, UDAs on 3 different counties. So lock your doors and be conscious, because not everybody that's in our area is from our area all the time. And there's things that happen here, and just I want to commend the team for doing a great job. It was pretty hectic there for a period of time.
They weren't local juveniles.
They were not local. No, they weren't. They were from basically the west side of the state.
Wow.
So we do have an officer leaving here at the end of the month. He is transitioning to a department down south a little bit. So that's gonna be a loss.
He's your school
That's
organizing
correct.
officer
That's correct.
too. That takes
That's
a lot of
correct.
training. So
Yep.
that's one of the downfalls.
Well, it always is. I mean, whether it's a.
Right, I understand.
Yeah, but yes, you're right. I mean, losing an officer, period, losing somebody that has that kind of training is obviously a significant loss. So we are losing one of our resource officers. And that's gonna be, again, another struggle. So I'm hoping that that's not an issue. I mean, obviously, we have open postings, but we're not getting anywhere with those at this moment. We are in conversation and have been in conversation with Atlanta schools about the situation. So this could affect that grant reimbursement. because obviously we don't have a dedicated officer full-time in the school. So I've been in contact with Superintendent Ruki, and we're discussing it. She's in contact with MSP Grants just to see what this is gonna look like. To ensure, one, we don't lose the grant. If we're able to provide officer even a part-time capacity, trying to figure out how we track that time and receive reimbursements for the time we have officers in the school. So it's a fluid situation, but I just want to keep you aware of what's going on with that.
So currently you have just the one woman trained and then this
Correct.
individual in that.
Correct.
If we have to, we can create a pay code that's SRO dedicated, so if an officer did dedicate time to SRO, we could track it that way.
Yeah, we'll definitely have to get with you because it'll probably be multiple officers that are going in and out of the schools. It's not going to be one. So
Right.
we'll have to kind of work together to figure that out. There was a discussion on Lieutenant Stan on our previous jail administrator that is interested in, well, is possibly interested in working part-time. There was some conflict on whether or not that was allowable through MERS. She did reach out to MERS, as did I, and there is a return to work form that MERS produces. And again, the individual that's interested spoke directly to MERS, and they said as long as this form is completed, she's eligible to return to work. There's no exposure or hindrance to her retirement package or anything like that. So if she's still interested, this is just a part-time capacity. It's on-call part-time. It's not a new hire. It's not anything in a way where there's any benefits. It's literally just part-time on-call. And or the biggest thing is we want to get her in to facilitate some training for the jail responsibilities. And this allows that to happen. We have that. There was, I believe it's $5,000 in the part-time budget. There's monies already set aside to accommodate for that position when needed. So if there's not an issue, if she's still interested, we'd like to bring her back on. Again, it's not a new hire. It's not a full-time. There's no benefits. It's just a part-time job.
So the conversation, when you talked to MERS, one of the things that when they told me is because of the informal agreement to bring her back already occurred. Did that get discussed?
Yep. Yeah, and they said as long as there was the separation for time and there isn't the preconceived. She left. At first, we talked about bringing her back. We found out we couldn't. She left. She was at that point in time, this individual wasn't sure whether they wanted to return or not. Life has, I'm going to say, calmed down a little bit. So again, if she's still interested, we'd like to bring her back. And MERS said there is no conflict with a previous agreement. The return to work form has to be completed, and after that, there's, I guess, no exposures is the way it's explained.
The deputy that hit the tree and was injured, how's he doing?
Good, thank you for asking. He's not back full duty, but we keep him very busy, but he's doing well.
Making forward progress?
Certainly.
So we have no guide or end of.
We're hoping in a month or it's up to doctor, to be honest.
Well, obviously that.
It's right around the November timeframe. Hopefully that's the latest we get an answer.
Okay.
So Lord willing, everything goes well.
Anything else?
So the part-time hours would be capped at 5,000.
Oh, we wouldn't even utilize that. I mean, that's
the funding.
That's the funding that's in there. Some of it's been used now. I think it's at 3,400 or something like that, but that's that part-time line that's built into the corrections. Well, it's on the general fund side, but it's for the corrections section. And then I know, one Bernie, I know attempted to put a maintenance record in. I think that got facilitated for the enterprise thing. So I know he kind of worked on that. The other thing I was going to ask, you were talking about that building, the building and grounds truck.
Mm-hmm.
Is that being sold through the fleet program?
Nope, we're gonna do sealed bids through the county since it's county owned. We can do either or since it's not a leased vehicle.
So the vehicles don't have to be sold through the fleet.
If they're leased, they do, but
Right.
not if they're not done. for lease.
So the only ones that have to be are the ones you purchase through the
Yep.
lease. Okay,
So how many has Bernie been able to get on?
I don't know.
But he is working on it?
Yep, I know we put, I don't know, 1 or 2 in this week, if I'm not mistaken. And I think that was it.
As of the last report for a part-time on-call CO, $625 had been utilized by Tim McDonald for the year so far.
Oh, that's it?
Yeah.
Anything else?
I guess, if for some reason a unicorn walks into our office to replace the officer we're leaving, any reason we're not allowed to pick that person up?
And
No, we-
It's a replacement, it's not a new hire, but I do want to bring it up just to make sure there's no,
I guess at this point, I don't know how it's gonna shake out. We've got $350,000 deficit. And I have no problem hiring him. I'm not saying you're gonna be there at the end of the year. I guess I don't know.
okay. I would, and I understand that that's a work in progress, but
Right.
I would like, if, again, fingers crossed, but if something were to happen, I would like to have that option.
Your last motion at the last meeting says that anytime you were gonna do replacement or a new hire or anything, you were gonna do it by case by case. So if you're going to allow you.
Yeah,
guys need to
I
make a
guess.
motion about it.
What I,
You
at
did it
this
for
point, I
probate.
don't, but I just caution that I don't know where we're headed in the budget. That's all I'm saying.
Understand.
Okay, all right, done, Sheriff?
Do we need a motion to that effect then?
Like I said, if you're
Yeah, I
gonna,
would- I
any
would.
person that's gonna be coming in and added to the payroll, you said that you're gonna do by case. So if it's the part-time CO or another officer, you're gonna need to make a motion about that, because that's what you said at the last meeting.
Yeah, when we replaced the individual in the probate office.
Right.
I would make a motion that if they get somebody come
Walk
in
somebody in the
to
door, yeah.
cover the SRO position, that he goes.
Well,
and hires.
that's up, Sheriff, we don't know if that's SRO or a regular deputy
Yeah.
or what it is.
Which, to replace that person. whether
Right.
it's-
It would be.
Yeah, I support that.
Motion second, any more discussion
What's the motion?
to allow, to replace the officer that's leaving if
a
he gets a
candidate.
candidate.
What's the update on this?
I guess you just allow the sheriff to replace the one that's leaving, I guess that's all
Kristen
you
said that
need.
they're holding it up on a lot of different officers right now.
Any more discussion on that? Hearing a call for a vote, all in favor say yes.
Yes.
Yes, nays, motion carried.
I guess just to follow up the jail, the part-time position. Is that, do you need to make a motion on that, or is that just?
That's up to the board here. I'm not prepared to make a motion on right now.
Well, I thought you had to confirm with her that she did in fact once.
Well, I'm not gonna offer something if I don't have it, I guess, kind of where I'm at. If the person's interested, I'm asking for permission.
And they're budgeted for already year, for this year. Yeah, for this year.
But there's no guaranteed hours. That line is the, that's all that can be utilized.
Yeah, however much you got in there is.
Yeah, and I think the controller said there's been just over 600 utilized out of that 5,000, so.
Yeah. I would make that motion as well.
Okay, we have a motion.
What's your other motion?
To pick up the part-time on the
Corrections.
corrections officer.
Support. We have a motion of support. Any more discussion on it? Again, do a roll call vote on it.
Gerardin,
Yes.
Voorhees,
Yes.
Pilcher,
No.
Bolster,
Yes.
Edwards.
No, and that's I voiced my several times on what I thought about that position and not having any jail, but motion carried. Anything else, Sheriff?
No, that was it, thank you.
Okay, I think we're down to standing committees. Del, you got anything?
Yeah.
You do?
I do. I do, and I'm gonna tell you about it.
All right, cool.
I can find my notes. On the night, we had a library building, library meeting. They're doing their addition. Update on that is they're getting permits from the building department and zoning, and they're looking at groundbreaking sometime in the spring, early as
Building what, an add-on to their?
Yeah, to the Atlanta.
Okay.
All right, yeah. They have, and in case you don't know, they have hotspots available for internet access for folks that don't have that availability, and they have 9 of them, and they use them all the time. They get a whole lot of activity out of those 9 hotspots. And it costs them approximately $1,900 a year to do that, but it's been a real good program. The Rural Libraries Conference for small libraries is going on in Springfield, Massachusetts, and the director Lori is going to be attending that this month. Beyond that, they've got their annual Halloween craft. It's a ceramic project going on. They've got a new hire over in Hillman that they've been looking forward to, so hopefully that'll work out well for them. At the Atlanta branch here, they did if you haven't been there, they've got a really nice vegetable garden out front that folks are allowed to take the vegetables that they like, and they have done all the work there, but next year they're hoping, they can get some volunteers to help them do some weeding and whatnot. And also in Atlanta, they're doing the Toddler's Story Hour is coming up. They had in Lewiston, what they called the Timberfest Toddlemania that they've done for a couple of years, and that had a really good turnout. And their fall book sale, they've had a great deal of participation in that. In Hillman, they do the VJ book sale, and that's been a real plus. They've been having some internet access issues over there, but they're working that out. That's about it. That's all I got.
I had a landfill meeting, finance meeting. The finance meeting, I already gave you a fantastic report. At the landfill, we got a report. It was a short meeting. We got a report from the engineering company on the methane gas that's escaping, and it's looking like we're gonna have to put the torches in out there. And then we had a local court meeting that April already reported on, so I won't bore you with that. That's it.
I guess the only thing I had was the security, finance and security meeting, and I went to the security meeting. I'm not gonna spend a lot of time on it, but when the alarms go off, the door is locked, so you can't get back in.
Yep, and I found out.
I guess, of course, Sheriff Rudisha was there. I guess my concern was the doors are locked. Firemen can't get in either, or emergency staff. And I have a problem with that.
It's a setting. I found out from EPS that, and Jared at Locksmith, he told me there's a setting within our atrium system to shut that off, so I can fix that.
Yeah, because it don't make sense for them to have to fiddle around for a box and so that's not gonna be in the system no more. Okay, that was my only issue on that.
On that point, there was a question about, there was one of the alarms one of the alarms that didn't work.
It was broke and it's being replaced.
Yeah. The question that came up, if one's broke, do the rest of them still work?
No, so they're all connected. So if there's been damage to one of them, it messes the system up because it's all electrically ran together. And that was something that we talked about. So we're, when EPS is here, we're gonna talk about, what's the fail safe for that.
Separate those and isolate them? Yeah, okay, thanks.
What?
Okay, I had 4. April's already touched on our
local court management council, so I'm not gonna expand on that any further. The other one was our new board, material management, which we met for the first time virtually. Yeah, I came in and April set me up on the computer. We're beginning to put things together. So a lot of people are needed. I believe there's 22 additional positions available just for Montmorency. And as other counties, they have the same amount of people. And we don't have another meeting scheduled for another month. Is that correct?
I think so. Yeah, in the people that they're looking for those positions, it's nominations, but there won't be that many from every county once the nominations are reviewed, and they'll pick a committee from each county. I'll put members from each county. So we'll have a guaranteed 2 sitting on that planning committee. And then other counties also have guaranteed 2, and then they'll fill in the whole spots.
Thank
And
you.
also, anytime that Lloyd attends a meeting or the planning committee attends the meeting, the interlocal agreement with the 5 counties, they will pay their per diem and their mileage for attending those meetings. It won't be county, because we're paying our money already to them. They'll take care of those.
No cost to the county.
So the people that they're looking for, those are qualified people. Correct? I mean, there are some qualifications in order to do that.
Yeah,
It's not just
not just a layperson. I think you have to have some involvement in something with it, right?
Yeah, well, yes and no, because there's elected positions, so there's not, no qualification for anything per se there. But the other positions, they have to have those requirements.
And then the day after our last meeting, I had a board meeting with NUMSCA. When Frances was here giving her yearly presentation, I asked her to speak about PACE and new program coming up, being enacted. And they have a building that they purchased right across the street from NUMSCA that they are totally renovating, and it's going to be huge. PACE is an adult daycare type facility, and the distance that they're going to make sure that older adult individuals are cared for in a very good manner. It's unbelievable.
They live there?
Huh?
They live there?
No, they won't live there. It's like daycare with children.
Oh, okay.
You
All
can
right.
drop them off, but
It's a
there's
day center.
people already there that are gonna take care of them. There's medical, food, the kitchens. They've got kitchens in almost every room out there. If you get a chance, you go out. It's right at the same plaza that the Secretary of State's in. So drop in, take a peek in, see what they're doing. It's just an unbelievable program. The other big thing that we had there, we have our food program has been shut down, and I was very much against it. When we voted, I voted I voted yay because the state is shutting us down. So there's nothing more we can do about it. They're taking everything away. Our warehouse is shut down, our equipment is sold. And we have one gentleman that started 31 years ago. He started our warehouse. He has worked diligently through the entire time, and he just retired. His name is Norm Apsey. He's been featured in our executive director's program. Did a fabulous job. The new appointee by the state is called the Food Bank of Eastern Michigan. So they're the ones that are taking over all of the food banks that NEMSCA and other programs like that used to have. On a grander scale, when Norm left, he had his to-be wife right there. They were going directly to justice of the peace, or I don't know where they were getting married, but they were at a retirement party and an hour later, they're gonna get married. So I thought that was pretty nice. And then I had a meeting with mental health. And I also had a meeting with Health Department number 4, but I'm gonna let Mary cover that. Mental health, we've had some problems with the HR program, the HR department. And we ended up having to replace our HR head. We've got a new individual there, and the turnaround in people that now want to talk and try to get problems resolved is just phenomenal. The old HR kind of squashed it all and took some very serious action against individuals that wanted things corrected or thought things were not being done right. Everything is turned around in that position. So that's a good thing. We also have self-evaluations on every board member that just went through. It was surprising. I thought we would have got 100% on everybody, but not everybody counts themselves as 100%. And basically they said the same thing. You know, you can improve every single day. So I thought that was pretty neat. We have a conference coming up October 20th, 21, and 22 in Traverse City. Once again, it's being put on by the Michigan Mental Health Department, and all of the instructors that teach these 1-hour programs are all college professors. They put out just outstanding classes, a phenomenal amount of knowledge, and I signed up for it, so I'm going to be going. And that's about it. That's all I have.
Okay, Mary?
Yes, and the department, the health department meeting we just had on Tuesday, besides the elk sighting, they did get a generator for the Rogers City office. We're still waiting for the one here. It's been, the work will get done, but they're trying to, our fiscal year ends in September, so we're trying to get it placed there. But it's not been placed as of yet, so hopefully in the next 2 weeks it will be. Discuss upcoming forum that they're going to give for parents regarding the lead testing for young children. That's going to be mandated now. There's mixed feelings on mandating things like that. And then we discussed the immunization rates in different counties. The waiver rates for kids in schools are going up, and the immunization rates from previous years are going down. They gave us that statistical information, and we amended a budget. We passed policy updates on personnel health policy and an administrative.
Oh, you forgot one thing. What was the grandest thing that happened on the front lawn?
Well, that's what I said. Less the elk that we saw.
A 3x3 elk. We're standing up to say the Pledge of Allegiance. Here comes this elk, right?
Oh, a live elk.
Yeah.
Yeah,
Oh.
walking right across the front lawn, just
Downtown Rogers City.
20 feet outside the window.
They say he was here last, said he was there last year too, and caused some grief.
We also talked about lead in the water. And I asked the question, how many lead pipes are in any of our municipalities in Health Department number 4 area? And I was told that every single municipality has lead piping.
But they're not leaching.
They're not leaching.
They're not leaching. But
Well,
they're being.
what
they're
lead is being
replaced.
leached is in the acceptable range. But I was really surprised. I didn't think we had any lead up here. Come to find out, every single municipality has.
Well, that was the old original.
Yeah. I'm sorry.
Okay, thank you. Next item on here is public comment. Public comment is 3 minutes on anything. It doesn't have to be on the agenda items. Anyone want to talk?
Yes.
Well, which one wants to go first? You got 3 minutes.
Okay, is that a new restriction?
No, we've had that right along.
Okay,
Okay,
before
because
he
you've
goes,
never mentioned it
well-
before. But I don't want to use up my 3 minutes. Lloyd and I were talking previously about the Hiawatha Dam project. And the Moose Dam is completed. My concern was when I went down, not that I'm qualified to do it, but just as an observer to see the dam. What happened was that there was a muskrat running across it. And immediately I said, now, that's the reason that all the damage was caused in the first place, besides the bank beavers. Problem being is that I thought they were gonna lay down cyclone fencing on the downside of the dam, so our little critters don't go in it. I talked with Charles Arbor about that, and he said that wasn't in the plans. The good news that he said was that Hiawatha Dam, they already have the design down, they have the permits approved, so the costs are gonna be less
For the next dam.
for Hiawatha.
Oh,
They
yeah,
don't know about the Causeway Dam.
okay.
That was the other thing. Okay, the other thing that I did was this, you have 2 packets in front of you. One being on, well, basically the same thing. Our president from the Senior Center Atlanta noticed on the McCullough board meeting minutes from July that there were drastic changes proposed in the meal plan at the center. What we also noticed was the 2 people that made that recommendation are Atlanta quote representatives, but we never voted on them. One is Atlanta at large. The other person we don't know about, and she sounds like a nice lady, but there are concerns. And that has to do with process, cooperation, and coordination. And if you look at packet 1, it has the members. We ran into a problem, and this is partly our fault, that there are procedures outlined that we were supposed to know 60 days in advance. Denny and I both missed that, but we sort of thought if there was an issue on who our representatives were, because we're supposed to have cooperation and coordination with McCullough, they would have notified us and then we would have discussed it. The other issue in packet 2 has to do with our site agreements, which have to do which group pays what at each of the centers. And part of this is that the auditor brought to the attention.
Time's up. Denny can take up the rest from here.
Okay.
I just wanted to make a note that the McCullough board appointment is gonna be on the October 3rd agenda. And I know
Well, he's here for a different concern.
Well, no, that also because the fact that I talked to Randy Long about that, who's the president of Lewiston, and he doesn't know James Madison. So it all.
He's not on it anymore. We're getting a person from Hillman, so it's 2, 2, and 2. Denny, you got something to say on that?
No. But I had something else I'd like to say.
I'm just gonna, on behalf of that, number 1, McCullough is a separate board. They're usually appointed by this board here. The problem, Ben, we haven't been able to get anyone on that. It's not my job to run around recruit people. I didn't know how she was doing it. We've changed twice. So there's little irregularities. We've been running with, actually from time to time, without a quorum, okay? Can't get people to apply for that. The little flyers that were put out to all the townships, or all the centers, right in there. We were missing people. We need people. Now, I don't know if that was supposed to be, you people supposed to look at it, or whoever the manager is that time supposed to call you. It's time to put some on. I have no idea how that stuff went, period. I don't know how it went. The bylaws say it's supposed to be different, what they've been doing. I
But
understand.
that's what I'm trying to get to.
I know what you're
get
trying to
going,
get
and
to.
we're trying to work it out, so we have process, cooperation.
Yeah,
and
well, I'm
coordination.
telling you right now, the issue was McCullough's losing money. A year ago, they lost $100,000. They dipped into their funds. This year's gonna be about 75,000. Reserve funds have to be used. The board decided to cut to give every center $12,000 this year to allow us to serve McCullough serve meals there. They were all getting around 18,000 a year in benefits and money. We cut that back. Of course, that was, and I'll have to agree, it was short term. We sent letters out not too long ago. We've had such a turnover there. There, in fact, we had a board meeting tonight they're gonna be at to try to get, try to change that to more money. So that being said, anyone else you want to talk about?
It's just that, just to back that up, Donnie, just because you're the rep for the McCoy, just maybe report in here would really help some understand. But my situation was that you all adopted a opiate process today. Now, my question was with, oh boy, we had a Kim Wilcox who was representing an opiate process that was set up through Lori Jimkowski that I knew of. Is it a duplication of, is it an add to, is it something different? Because to my knowledge, Kim contacted me because of the senior center and it's like, she's out of it. So I just wanted.
Okay, so Kathy actually came and talked to us about that. Kim is done doing the recovery meetings. We still pay the rental and Kathy was gonna wait to cash a check to see for this, we still have meetings. The steering committee was gonna look to see if we had somebody else that might have been interested in taking over those meetings. And then we're trying to get somebody to replace her to continue those meetings. And we're gonna call Kathy as soon as we have confirmation on who would take them over.
Okay, but is that like, I don't know what it is, but is that a duplication of an opiate program, working with people that this gentleman was here talking
No,
about?
so he's doing actual medical treatments and services for people from LPM Montmorency in his clinics. This is a recovery, like AANA meeting that they're having where people who are suffering can meet together and have that meeting.
Okay, I mean, the board knows about it. Then
Yep,
that's all I
yep,
wanted to
that's
make
something
sure.
they approved that they're gonna keep doing and they do one in
Yeah.
Hillman as well.
Yeah,
Okay.
and those opioid funds, we just have we're kind of like a pass through. We get the funds and then they have
Yeah.
to meet the
Well, I
criteria.
just want to make sure it wasn't a duplication of, and that you all knew about it. And it's, it's just, it's a community action program, which works. It's just that you got some, find somebody that works.
Yeah, we're still trying to confirm somebody to manage those meetings, so.
Yeah. No,
Once
it's
we
not-
do, we have
not
Kathy's
easy.
information, we'll let her know, so that she can get them in the building, basically. But on the opioid, they had asked about the jail prescriptions, and the only thing I find in the opioid remediation allowable expenses is treatment for incarcerated population. One is to provide evidence-based treatment and recovery support, including MAT for persons with OUD and co-occurring SUD/MH, mental health disorders within the transitioning out of criminal justice system. And two, increasing funding for jails to provide treatment to inmates with OUD. So I think the only way we could pay for prescriptions is if they were OUD treatment
Yeah, and that's,
or mental health.
It doesn't meet that criteria.
I don't know what their specific prescriptions are for at this moment.
Well, maybe that could be evaluated because maybe, I can't think of her name right now from Michigan.
Amy.
Yeah, maybe Amy Galinsky.
I'll check with her.
Cheryl?
Just real quick, on the materials management, I don't know how many more people are needed. I guess recycling has always been something I've been interested in, even when, my girls were young and growing up, we had, some containers and things here that we were able to put our recycles in, we've done that. I still continue to do that today. I actually drive my recycles over to one of the Gaylord sites to drop off. If that's something that I could maybe sit on, if I don't know, again, what your criteria is, that'd be maybe something I might be interested in doing.
I can send her stuff to Kristen and then the board will appoint.
I think then they ask for elected officials on that.
Yeah, we have to give a list of who will nominate and then they'll choose, so I can just send her information over to Kristen and then it'll go in front of NEMCOG and the planning committee or the board for management materials, and then they will make the final placement of all the committee members, so then that would give us 3 that we've nominated for that. So I'll send Cheryl's information over.
I'd like to see something back in our area, I always have.
Sure. They're looking for good people that's actually into it, makes a lot of sense. So,
Yeah, it's gonna happen. It's just.
Yeah,
well, you get forced to it whether you think it's a good program or not.
we're gonna be required to the very least have recycling transfer container in Montmorency County, multiple, if not at least one, but not maybe multiple. And then it'll be going to, so that's one of the requirements of this whole plan. We will have recycling within the county.
Okay, anything else? We adjourn the meeting, we're all done. Huh? Motion to adjourn. You wanna-
I'll second.
Aye. All in favor, say aye.
Aye.